Okay, now this is really interesting to me. This next point is I've gotten to know Doug. I've watched his work. I've studied what you have written about what you're doing. And I was shocked to learn that inflammation causes more, is it true or false, more heart attacks than any other factor.
It's true.
And you told me that 62% of all heart attacks are people who have 0 to 1 risk factors.
That's correct.
And their doctor would really give them a clean bill of health.
Unfortunately, that's true.
Okay,
Yeah.
Now tell me a little bit about what you're doing and the tests that you've created to deal with that, or your company has done, because it's fascinating to me, and how inflammation relates to all of this.
Right. Well, you know, the interesting part of this is that this was a Stanford University spin-out. It's been 10 years of research, and what most people don't know is the most common cause of a heart attack is not narrowing of the arteries, which is what most people believe. It's actually rupture of something that's called unstable plaque or soft plaque or vulnerable plaque. It's like a pimple on the side of the artery, and if you were to do a catheterization and put media in there to try and illuminate it, you may not even see it. What happens is these plaques are formed by oxidation of lipids, of fats, the type that Don talked about, the worst kind being trans. And what happens is they go through the wall of the artery and create an inflammatory focus, which then collects more inflammatory cells, creates more inflammation, gets a little fibrous capsule over the top of it that's not quite very strong. And if that pops, it causes a blood clot almost immediately, and that's what kills people. We looked at animal models first. We looked at the way plaque forms in animal models, and we identified the pathways that are involved in that, and these are mostly inflammatory and remodeling pathways. We identified 250 proteins, and of those 250 proteins, we did a number of studies to narrow it down to the most important. There were about 32 of them, and we did some further studies in humans to identify a way to combine those molecules. There were 7 of them that were extremely powerful. They're all involved in inflammation and remodeling. And with those, we were able to identify a person's risk of having a heart attack due to the most common cause of heart attack within a 5-year window, but with enough time to actually do something about it. I've clearly made Cellgevity a part of my practice, as I know Don has too. And for a hardcore scientist like myself, that's a big admission, because I like the science behind it. I know the process behind it. I know that our mission is to identify people at risk, but then we have to do something for them, and we want to do something beyond statins, which are the kind of the standard of care right now. They have a lot of complications. They're good drugs, but the other thing that's important is that exercise is as effective as statins, or maybe even more effective in the right way that you do it. It strengthens the cap over it, decreases inflammation. But think about combining that with glutathione enhancement. Man, now you're really talking some serious preventive strategy. And so our company is devoted to that. We've developed a blood test that will help identify these people. And I want to stress also that this is not meant to replace anything that your doctor is doing right now. What it's meant to do is address the 50% of patients who have normal lipid levels, normal cholesterol, normal good cholesterol and bad cholesterol, who are currently having heart attacks.
The other thing that's so important too that we can't neglect is an anti-inflammatory diet. Exercise very important, as well as taking the ribosine, boosting the glutathione levels, but also identifying those inflammatory foods, minimizing them, taking anti-inflammatory foods to balance out the inflammatory foods, as well as cooking methods. I tell people cooking methods are so important, like frying. When you deep fry food, you create so much more inflammation, as well as grilling. When you grill food, you create a lot of heterocyclic amines, benzpyrenes, polycyclic aromatic hydrocarbons that create inflammation in the body.